Good morning and welcome to this lecture on EMS Systems for the Emergency Medical Technician. Each module that we cover within this lecture and within this course, we work within the National EMS Education Standard Competencies. And in the preparatory section, which EMS Systems is covered under, what we are talking about is that after you complete this area, you should be able to apply fundamental knowledge of the EMS system, the safety and well-being of the emergency medical technician, medical, legal, and ethical issues to the provision of emergency care in the pre-hospital setting. EMS systems consist of the system itself, the history behind it, the roles and responsibilities and professionalism of EMS personnel. We talk about quality improvement and patient safety. We also talk about research in EMS and its impact on the field. We talk about data collection and evidence-based decision making. As far as public health goes, when we deal with public health, we talk about simple knowledge of the principles of illness and injury prevention in emergency care. So your textbook we are using in this course is the primary resource for the emergency medical technician course. EMS is a system, and in chapter 1 we're going to talk about why it is a system and what are that system's key components. The EMS system basically is made up of a team of healthcare professionals. We provide emergency care and transport to the ill and the injured patients, and it is always governed by specific state laws. This course trains you to take a certification exam, and in Montana we currently utilize the National Registry EMT certification. After you successfully complete the course, you will be eligible to sit for both the practical portion and the written portion. After you pass the exam, you can then apply for licensure in the state of Montana. Most states today have 4 training and licensure levels. They are EMR, or Emergency Medical Responder, EMT, Emergency Medical Technician, AEMT, or Advanced EMT, and then Paramedic. EMR has very basic training. Emergency medical responders provide care before the ambulance actually arrives. They may also assist within the ambulance, but the ambulance must meet state requirements for a legal crew. The EMT has training in basic life support, and that includes automated external defibrillation, use of airway adjuncts, and assisting patients with medications. The Advanced EMT has training in advanced life support, including intravenous therapy and the ability to administer certain emergency medications to patients who fit certain criteria. Paramedics have extensive ALS training, including endotracheal intubation, emergency pharmacology, and cardiac monitoring. Those folks in this course who wish to go on to Flathead Valley Community College's paramedic training program will need to apply during the application period every year and make sure they meet all of the entry requirements. There are 4 learning activities included in any EMT course. These include reading your assignments, listening to these lectures, and then participating in classroom discussion. There will also be step-by-step demonstrations of skills and assessments. There will be summary skill sheets that you will need to use, and then you will also participate in case presentations and scenario-based training. EMTs are the backbone of our system. They provide emergency care to the sick and the injured. Sometimes these patients may be in life-threatening situations, and others may only require supportive care. There will be times when you find yourself in either of these realms. Some of the subjects discussed within the training program include scene size-up, patient assessment, treatment of your patient, appropriate packaging for and preparing for transport, and then talking about EMS as a career in general. Requirements differ from state to state. The general requirements to be an EMT are you must have a high school diploma or equivalent, which is a GED. You must be able to prove immunization against certain communicable diseases, and you must have a valid driver's license. Successful completion of these things also give you the ability to take that national certification exam. Basic life support CPR for healthcare providers. This we will be doing as a part of this course, and you will receive your certification card in CPR as a part of this course. The course has to be state approved. Our program, our EMS program at Flathead Valley Community College, does meet these requirements, and all of our courses are offered under the umbrella of our program approval. You must take a state-recognized written certification exam. Currently, in Montana, you can take the NREMT written certification exam and then also a practical certification exam. If you were to not want to take the national exams, you could take a state exam here. At this point in time, the state exam requirements have not been set in stone. You need to demonstrate that you can meet mental and physical criteria necessary to perform the job. It's not just about driving the ambulance and driving patients to the hospital. You have to be able to physically lift and move patients who may weigh in excess of 200 pounds. They may also be in a position where they can't assist you. You may only be working with one partner, and you have to make the determination how to safely and appropriately move your patient. You also need to comply with other state, local, and employer provisions. One of the things we have to be aware of is the Americans with Disabilities Act. That guarantees that disabled individuals access to state and local government programs, and it prohibits employers from failing to provide full and equal employment to the disabled. If you have a documented ADA disability, you need to contact your instructor or myself. My name is Chris Long, and I am your program director for the EMS programs at FVCC. There are certain things in EMS we can work with within ADA, and some things we can't. Next, we're going to move on to overview of the EMS system. In the history of EMS, our origins include volunteer ambulances in World War I, field care in World War II, and field medic and rapid helicopter evaluation in the Korean conflict. During the Korean conflict, many of you may or may not remember or have seen it in syndication, the TV show MASH. That was where they actually utilized both helicopter and ambulance evacuation from the front lines to mobile Army surgical hospitals that were stationed near the battlefields. EMS as we know it today originated in 1966 with the publication of the White Paper, also called The Accidental Death and Disability, the Neglected Disease of Modern Society. This paper came about as a study that identified the shortcomings of our ability to provide emergency care at the scene of especially accidents. The Department of Transportation published its first EMT training curriculum in the early 1970s, and it has undergone many revisions since that time. The American Academy of Orthopedic Surgeons prepared the first EMT textbook in 1971. It was also known as the Orange Book, and the book we are using in this course is the 10th edition of that book today. Efforts have been underway for some time to standardize the levels of EMS education nationally. As of 2013, all paramedic training programs in the United States must be nationally accredited. If they are not nationally accredited programs or in the accreditation process, individuals who take those programs may not sit for the National Registry EMT paramedic exam. They would have to take a state-specific exam or some other type of exam, but they could not receive national EMS certification as a paramedic. EMT education, while recommended that it be accredited, has not been required. However, most educational institutions who provide EMT training and paramedic training try to make sure that they meet the same standards across the board. At the federal level, the National EMS Scope of Practice Model provides guidelines for EMS skills. It details what skills each level can perform. At the state level, EMS law and administrative rules regulate what we can actually do, how we operate out in the field. And at the local level, your medical director decides day-to-day limits and protocols of EMS personnel. So within that national EMS scope of practice model, there is a hierarchy. You have the model itself, which is the theory, it's the foundation. You have medical direction, which is day-to-day operations, and you have state EMS offices, which administer perform regulatory functions as well as legislative and liaison roles. And all of these do overlap within how we work. Millions of individuals are trained in basic life support CPR. Teachers, coaches, child care providers, many types of education and supervision of children require that individuals who are in that role have CPR certification. Folks who regularly accompany groups on trips to remote locations also receive first aid and CPR training. They may also do first responder. And automated external defibrillators are in use nationwide and worldwide by lay people. There are public access defibrillator programs in every state, including ours, and that's why even here at FBCC we have AEDs in every building. We have people trained in first aid CPR in our community, both faculty, staff, and students who can assist in the event of an emergency. Emergency medical responders, remember that's the first layer that we talked about within the system of identification of certification levels. Generally, these folks are law enforcement officers, firefighters, park rangers, ski patrollers. These folks initiate immediate care and assist EMTs when the EMTs arrive. They're great to have on hand. It's always nice to have an extra pair of hands, especially when you're dealing with people who are ill or injured. Good Samaritans who are trained in first aid and CPR oftentimes show up at a scene. They can provide valuable assistance. However, it is not uncommon that they interfere with our operations and may endanger themselves or others. Lay people are always willing to help, and they are always willing to tell you how they can help. Just be sure you understand your own agency's policies as far as these lay rescuers assisting you. Generally speaking, an EMT course requires about 150 hours. You have to provide the lecture, which includes the didactic training and the knowledge-based training, the skills-based hands-on psychomotor training, as well as the affective behaviors where we put you out on ambulance services and let you gain some valuable experience there. You will have knowledge and skills in order to provide basic emergency care. Once you arrive on a scene, the EMT assumes responsibility for assessing, managing, caring for, packaging, and transporting their patients. The advanced emergency medical technician adds knowledge and skills in specific aspects of advanced life support. These include things like initiation and maintenance of IV therapy and intraosseous therapy, advanced airway maneuvers, including advanced adjuncts, and administration of certain medications contained within guidelines and protocols. Paramedics have extensive training in their programs. Most programs are anywhere from 800 to 1,500 hours or more. The program here at FBCC for the core training is more than 1,300 hours. It may be offered within the context of an associate's or bachelor's degree program, and ours is an Associate of Applied Science degree program. And we give you the ability to perform a wide range of ALS skills, functions, and assessments. Moving on to the system itself, there are 14 components of an EMS system today. We'll go through all of these. Public access. This is all about 911. How do you access your EMS system or your public safety system? Communication systems. How are you notified? How does dispatch notify the ambulances and the EMS crews and the first responders to respond? Clinical care. How you care for people. Human resources. How you manage your people within your agency. Medical direction. What can you do and what can't you do based on protocols and standing orders? Legislation and regulation. What are the laws and rules governing your operation? Integration of health services. Realize we are only a spoke in the healthcare wheel. And if you think about that, at the hub of the wheel is the patient. And all of the spokes are the different health services offered, from 911 dispatch to first responders to EMTs and paramedics to emergency physicians and nurses to flight crews to allied health professionals like surgical technology, surgeons, radiologic technology for x-rays and radiologists, physical therapy, occupational therapy, ICU nurses. It's all an integration of health services around that patient. Evaluation of the system. How does the system work? Information systems and gathering of information. How do we pay for it? In Montana, we still unfortunately rely heavily on volunteers to staff our system. And that's not a very fair thing to folks who spend lots of time and money to gain this training. What are the education systems like? Now the standards are we have to meet the National EMS Education Standards. We talk about also prevention, because if we can prevent some of these accidents and illnesses from happening and work with our patients to not abuse our 911 system and our EMS system, we can actually better manage our system. We also have to consider public education as one of the components, and research. It never stops with just doing the job. We always have to research. So this is the system basically in a circle, okay? So let's talk about this for just a minute. Public access, recognition of the incident and access to 911. Your communication systems is your dispatch centers from taking the 911 call to dispatching the responders. Your clinical care, your first responders, your basic life support, your advanced life support, and your ground or air transport crews. And then we move into emergency department facilities, specialty care, patient rehab, prevention awareness, and public education around this circle within those 14 components. We have to think about specialty patients like pediatrics and poisonings and cardiac and stroke centers and trauma centers. Where is the best place for our patients to be transported to? So let's talk about the beginning, public access. Easy access to help in an emergency is essential. There are still places in the United States that do not have access to full enhanced 911 systems. 911 is our public safety access point. In Flathead County, we have enhanced 911 with anti-alley locators. And one of the big downfalls of this system is with so many people moving away from home phones and landline phones in their houses or businesses, and the implementation of cell phone technology, where everybody's using cell phones, it doesn't always give you exact information of the location. They can pinpoint it down to a specific area, but may not always be able to get help if they don't get the right information. Emergency medical dispatch is a system that gives callers medical instructions until EMS arrival. There are many different systems out there. Flathead County's 911 Center does use an EMD system, and that gives these folks information, callers calling in, and it also helps to triage and prioritize how our ambulance service is dispatched. Communication systems. From the beginning of the 911 call, the caller information, your dispatcher will select the appropriate parts of the emergency system to activate. EMS may be part of a fire department, part of a police department, or independent. In Flathead County, there are independent third services, there are private third services, there are nonprofit third services, and there are fire and EMS agencies. Fire-based. We don't have many EMS agencies per se that are part of the police department, because the Flathead County Sheriff's Office has a SWAT team. They do have an EMS license for first response. But that's the only EMS agency I can think of in this area that's part of a police department. New technology helps responders locate their patients. Cell phones can be linked to GPS units, which gives better coverage, but again, it does not give ultimate coverage. Realize that a cell phone is only as good as the tower it bounces off of to get the signal to the 911 center. When we talk about clinical care, we're talking about not only the equipment utilized or the tools that we're going to use within our job, but it also talks about the scope of practice for using that equipment. What levels of care can utilize equipment, and what parts of the equipment can they utilize? It is important that EMTs are familiar with ambulance controls and with their primary service area. All ambulances have a primary service area. They also respond in mutual aid agreements as closest available resource. It is important that you realize and understand that as a part of a service, you need to keep on top of this. Human resources focuses on the people who are delivering the care. We have to talk about how they're compensated, how they interact with other members of the medical community, and their well-being. It is important that an EMS system take care of their people. Efforts are underway to allow EMS providers to move from state to state. Part of the National EMS Education Standards and National Certification is portability. It is very important that you realize that with national certification, there are far more states who accept national certification than those who don't. So realize that that national registry certification standard is important if you think you may possibly move somewhere else in the future. Medical direction. The physician medical director authorizes EMTs to provide medical care in the field. There are two different types of medical direction, online and offline. We'll talk about those in a moment. There's also medical direction for education programs. Our medical director is Dr. Rob Bates from Kalispell Regional Medical Center. And then there are medical directors for services and EMTs. And in Flathead County, Dr. Richard Briles is our medical director for Flathead County EMS, and he covers all the EMS agencies and EMTs and paramedics in the valley. Appropriate care is described in standing orders and protocols. These are the things we are designated that we can do based on our certification and training. Online or offline medical control. Offline is indirect, and that is protocol, standing orders, training, and supervision, where we function based on what we know. Online or direct medical control is where we contact the physician for directions given over the phone or radio. For many years, radio was the only means of communication, but again, with cell phone technology, far more paramedics, EMTs, and advanced EMTs have gone to using cell phones to contact physicians as opposed to giving information over a radio frequency. When we talk about legislation and regulation, we have to think about training, protocols, and practice follow state rules. Senior EMS officials handle administrative tasks like scheduling, personnel, budgets, purchasing, and vehicle maintenance. That is part of senior officials within an agency. But we do have to follow all of the requirements under state legislation. In Montana, we actually have 2 separate state offices that deal with what we do. There's EMS service licensing, which is handled from Department of Health and Human Safety. And then there is EMT licensing, which comes under the Montana Board of Medical Examiners. So EMT licensing is about people. EMS licensing is about services. Pre-hospital care by EMTs is coordinated with care administered by hospitals. Care simply continues from the scene to the emergency department. And this will ensure that patients always receive comprehensive continuity of care. Evaluation of EMS systems involves many different components. The medical director maintains quality control. The medical director has the ability to evaluate each field provider in what they are doing and how they are doing it. Are they successful or not? Are they good at what they do? Continuous Quality Improvement, or CQI, reviews and audits the system. All EMS providers are required to complete both refresher training and continuing education as a part of their National Registry certification. For example, all levels except for EMR require 72 hours in a 24-month period. The EMT has 24 hours of required refresher material and 48 hours of CEUs, or continuing education units. At the paramedic level, it's reversed. There's 48 hours of refresher training and 24 hours of CEU units. Our goal with evaluation within the EMS system is to minimize errors. Information systems are used to document care provided. It's come a long way from the days where we wrote paper reports to now everything is being done electronically. And EMS is no different. Very few agencies continue to write paper reports. Most of them actually use electronic medical records or an electronic system to document care. Once you have this information stored electronically, it can be used to improve care and to run your QA/QI reports. It can help you determine your on-scene time for trauma patients. It can help you determine if there is a need for additional education within your agency or unit, and what are the national trends. How do we pay for it? Probably one of the most important questions in EMS is, how do we finance our system? It varies depending on the organization involved. So this table talks about the type of EMS services that transport patients within the U.S. And it's funny to see that 34% are at both private organizations or fire departments, okay? So those private organizations are generally for-profit, where the fire EMS agencies, fire-based EMS, are not. City or county third service is also usually a non-profit or a not-for-profit, owned by a municipality but not based out of a fire department, and that's at 18%. Hospital-based services, 5.4%. Public utilities, that seems a little strange, but 2.7% run out of public utilities. Public safety agencies, police, fire, EMS, these are agencies that actually do all three. And if you're hired in this agency, you're an EMT or a paramedic, you're also a police officer, and you're also a firefighter. Whatever the call is that comes in, you do. And then law enforcement. As I said, realistically, very few law enforcement agencies are involved other than at the first responder level, because they don't generally transport patients. There can be a combination of paid volunteer or a mixed department. EMTs can also be involved with gathering insurance information, attending fundraisers, and other activities to help secure financing. Many services today bill for their services, and so they can only bill for patients that they transport, and so it is important that the EMS crew gets appropriate insurance information from your patients. Education systems. EMS instructors are licensed in most states. In Montana, it's an endorsement on your license to practice. So as a paramedic, to be a lead instructor, you must have an EMS license to be able to be an EMS instructor. Advanced life support training generally provided in college, adult career center, or hospital settings, and continuing education is obviously needed to update knowledge and refresh skills. If you get into this business and think you'll never have to take another class, you're probably in the wrong business. EMS is always changing and always continuing, and in order to be successful, it is very important that you stay on top of what you're doing and you stay fresh and continue to educate yourself. Prevention and public education are two components of the EMS system with a focus on public health. Public health is a relatively new aspect in EMS. Some of the things that public health is involved in is vaccination programs, fluoridation of water supplies, helmet laws, regulation of sewer systems, formation of the Food and Drug Administration, clean drinking water programs, seatbelt laws, tobacco use laws, restaurant inspections, and prenatal screenings. Public health is huge in prevention. EMS works with public health agencies on primary and secondary prevention. Primary prevention focuses on preventing the event from ever happening in the first place. Some of the ways public health is involved with this is seatbelt laws, helmet laws, trying to get folks to be better educated in prevention of injury. Secondary prevention happens after the event has occurred. For example, the elderly patient who trips over a loose rug on their kitchen floor and falls and injures himself. Some of the ways we can get involved there is helping this patient evaluate the needs within their home and make some changes. EMS Research helps determine the shape and impact of EMS on the community. EMTs can be involved in research through gathering of data. A huge part of what we do after the call is documentation and data gathering. And then evidence-based decision-making is based on research. There's a lot to be said for evidence-based medicine. What works has worked for a very long time and continues to work. For example, high-performance CPR. One of the things you will hear as we talk about CPR and changes that come in CPR is this is something that's been based on evidence and data gathering from within the field, and where we've been on calls that have been cardiac arrests and had successful outcomes. We're going to move on now to the roles and responsibilities of the EMT. There are lots of things EMTs and all EMS providers are responsible for. You need to be involved in keeping your vehicle and equipment always at the ready. If your equipment is not at the ready and you get an emergency call, you may not have what you need, and that in and of itself is a liability. That is a breach of duty within the elements of negligence. You should always ensure the safety of yourself, your partner, your patient, and bystanders. You're going to hear this a lot throughout this training program, but you are number one. Yourself, then your partner, your patient, and bystanders. Always important to make sure you're aware of safety considerations. You'll learn how to operate an emergency vehicle. We do not teach that as a portion of this course. That is an agency-specific criteria as to what and when you can operate emergency vehicles. You need to be an on-scene leader. Leadership is a key role in EMS, and all EMTs, paramedics, all certification levels are leaders. You will be able to perform an evaluation of the scene and of your patient. You'll call for additional resources as they are needed. You can gain patient access and then actually perform your assessment of your patient. You will give emergency care to your patient while awaiting the arrival of those additional resources. This is not a job where you stand around and wait for everybody else to show up and then you all work at once. You're going to be out there with you and a partner working on patients while you're waiting on those resources. You will only move patients when it's absolutely necessary to preserve life, and you will give emotional support to family, patients, and other responders. It is important that you are always empathetic with your patients, family, and responders, and that there will be times that will stress you to the maximum, you still need to provide that emotional support. That is a part of your job. You will maintain continuity of care by working with other medical professionals. As I stated earlier, we are only a spoke in the healthcare wheel. We work with all different levels, all the way up to physicians. We interact with physicians on a daily basis, and you must be able to do that. You will resolve emergency incidents. You'll uphold medical and legal standards, and you will ensure and protect patient privacy. This is federal standards that can be very harsh on your agency and you if you fail to abide by them. EMTs are also involved in giving administrative support to their managers, constantly continuing professional development, cultivating and sustaining community relations, and giving back to their profession. All EMS providers must adhere by professional attributes. Some of the things we're talking about here include integrity. Integrity is all about doing the right thing even when nobody else is looking. It's about yourself. Empathy. This is not sympathy, but this is feeling, at least feeling compassion for your patients and their family members and your coworkers. Self-motivation. Being a self-motivated self-starter is huge in EMS. We have to be this way. Appearance and personal hygiene. Just take a look at the pictures on your right of the screen here. Look at the professional and look at the unprofessional. Looking unprofessional or unkempt is not appropriate at any point in time. You need to be self-confident. You need to be a good time manager. Your communication skills with everyone must be to par. You can't be afraid to talk to people. You have to talk to your patients, your coworkers, your physicians, and nurses. You have to be a team player. There is no I in team. In EMS, we are team players. You have to be diplomatic in what you do. You have to respect others. You have to be an advocate for your patient. That is probably the number one thing I can stress here. You have to be responsible for careful delivery of care, doing only what you are able to do within your scope of practice and protocol. And every patient we encounter is entitled to compassion, respect, and the absolute best care we can ever give. As a healthcare professional, EMTs are bound by patient confidentiality, and you need to be familiar with the requirements of the Health Insurance Portability and Accountability Act, also known as HIPAA, and we'll cover this in more detail when we review Chapter 3 on medical, legal, and ethical issues. In summary, these are the things you need to think about. EMS standards are governed by state law. EMS ambulances are staffed by personnel trained to EMR, EMT, advanced EMT, or paramedic level based on state law. An emergency medical responder provides care before an ambulance arrives or may perform as an assistant within the ambulance. An EMT has training in basic emergency care skills and basic life support. An advanced EMT has some elements of ALS training, and a paramedic has extensive, long, involved ALS training. After scene size up, EMTs provide care and transport. The National EMS Scope of Practice Model provides skills guidelines, and the EMS Agenda for the Future includes the 14 components that make up an EMS system. EMTs have roles and responsibilities as well as attributes to reduce suffering, pain, and mortality of patients. Currently, EMT courses provide information needed for certification, and you have to commit to continued lifelong learning. EMTs are bound by HIPAA and its effects on patient privacy.